figures from Ghana's 2010 population and housing census says that over 737,000 persons live with some form of disability, representing 3% of the Ghanaian population. Out of that number, 15% are persons with hearing impairment, while 13.7% have speech impairment. It is estimated that we should have more figures than what we have from the 2010 census. Having only one means of communication, a language that almost all other people do not understand, most of these hard of hearing persons find it difficult to communicate effectively in society, and they have decried access to information during this period of pandemic. Let's have a conversation about this. Joining me in the studio now is a member and advocate of the Ghana National Association for the Deaf, Robert Sampana, and the president of the National Association of Sign Language Interpreters of Ghana, Clement Sam. Thank you both for joining me. I'll start with you, Robert.
That's great.
Have you heard about coronavirus?
Yes. I'm deaf, but I know a little about it. I wasn't born deaf anyway, but I had residual hearing, and at the age of 12, I became deaf. So I have some sort of speech. I got sick, and that's how come I became deaf.
Okay. How did you hear about coronavirus?
So, as a deaf person, access to information is very difficult. I don't have speech, I can't hear, but the news and reading.
Oh, so he heard it via the news. I mean, he read it in the newspapers. Is that what it is?
Yeah. I would love to be honest with you. Yes, I'm one of the few who is able to read, but the majority of my colleagues, some of them can't read. They can see, yes, but they read and the understanding is not that clear, especially the details.
Okay. Now, I'm sure that you know that the president has been updating Ghanaians on the coronavirus pandemic. And I'm just wondering, even though you say you have been reading about it, how are you and your colleagues coping? And do you think that your concerns have been factored into all of these broadcasts?
Thank you for that question. Yeah, twice the presidents have updated the nation. And also the Minister for Information has done press briefing on that. And on those occasions, there were no sign language interpreters. Also, the President's updates, I heard it was good, but there was no interpreter there. So how are the deaf people going to get access to that information and the guidelines that the President has given?
Have you been speaking to your colleagues? What do they know about coronavirus? Those who cannot read and write.
Well, to be honest, most of them don't know anything about it. They don't know anything about the coronavirus. Myself, I saw it on TV, and, I had to ask friends and read about it. So the majority of my friends do not know anything about it. Okay. If there were an interpreter, they would have gotten access to it.
Okay. In your own little way, Robert, what have you done to educate your colleagues now that you know, or since you've known that they are not aware about the disease? What have you done?
Okay. Well, I need to, first of all, thank GHOne TV for the opportunity to also talk about this issue. But myself, I do not have that access or opportunity to meet all deaf people in the country to give that information to. I think it's the responsibility of the government. That is why the president does that update. And also the Ministry of Health, that is their core mandate to educate us on how to do it. But for me as an individual, I can't do much. I think the president and the states have ignored, deaf people in disseminating information because of no access to sign language interpreters. How do we get access? Then how? How do we do it? So you see, that is the issue. That is the challenge we have now.
Okay. What do you want the authorities to do moving forward?
I want the government to, and also the minister responsible for information, to always have an interpreter. It is a must. It is a professional sign language interpreter who will be, relaying whatever is being said. Whatever the government, whatever updates the government brings should also be in sign language for us to understand. And also, we have an association for the deaf people in the country called the Ghana National Association of the Deaf, and they have reps there. So when you go there, the information also can be disseminated. Okay,
but as it stands, what really, Robert, do you know about coronavirus and what to do to prevent yourself from getting it?
Like I told you before, if I was sick, for example, as a deaf, because of all these updates, I've not gotten a lot of information about it. I watch TV, I see people there, people with nose masks and what have you, but as to what it means, I don't know. So I don't have much information on it myself, let alone the rest of my colleagues who can't read. So for us to be safe, assuming one deaf person contracts the coronavirus, that is going to be deadly.
Okay.
That is why we are advocating for an interpreter.
Okay. Have you made your concerns known anyway? Since you have been seeing all of the updates or the addresses from the president and with the concerns you have you put it in writing to let the authorities know that you feel neglected?
Yes, that's right. Yeah, I've done lots. I think 2 weeks ago when the Minister of Information had a program, there was an interpreter there, but the interpreter was cut. We couldn't get access to the person. And I WhatsApped the minister. I sent him a text message to that effect that, look, we are not getting the information, as it were. It's a live program. So we're planning to meet the minister to have a discussion on that.
All right. Thank you very much. Robert Sampana is a member and advocate for the Ghana National Association for the Deaf. And Clement Sam is the president of the National Association of Sign Language Interpreters Ghana. Hopefully, the next address from the president will include persons who have hearing challenges and speaking impairment.
I hope your TV station will also do its best in supporting, especially in advocating for the needs of persons with disability, like you've done this afternoon with an interpreter. Thank you so much.
Thank you too. Right, you're watching GHOne on GHOne TV. We just had a conversation, and we hope that the duty bearers are watching and are listening. In your next address, we want to see you include persons with hearing impairment.